Well, I am Dr. Iqbal Pirzada. I am working as an additional director at Ojha Institute of Chest Diseases, Karachi, Pakistan, for the last 23 years. I did a specialization in TB and chest in 1990, and since then I am serving and working in the institute. This institute is the largest institute of the province of Sindh of Pakistan, and it is really working against multi-drug resistant tuberculosis, the best in the country. So this is my background, and I am very much affiliated, working there, and we are really serving and trying to serve and trying to decrease the burden of the chest diseases, especially tuberculosis. Any question you want to ask, I'm ready to.
Yeah, Doctor, it's really a persisting thought from yesterday itself. That can you explain in a brief term what is TB?
Tuberculosis is the world's oldest, most old infectious disease. It is caused by a bacteria which name is Mycobacterium tuberculosis. It is a transmissible disease, infectious disease. When someone who is harboring, who is already diseased, is having bacteria in millions in his chest, when he coughs, when he laughs, when he shouts, when he sings, he expels them out into the atmosphere.
So, if I disturb you, what are the other organs which are really affected by this TB?
Mostly it is the lungs. Otherwise, all the body organs are affected. No organ is left, can be spared from this. That is called extrapulmonary tuberculosis. And the lungs is called pulmonary tuberculosis.
How do we identify what are the symptoms of this sickness?
It's very common because mostly it is the chest disease. There are three most common symptoms. Number one, an unexplainable cough for more than 2 weeks. An unexplainable fever, which is mostly in the evening with a lot of perspiration. It is also unexplainable. You have taken a lot of antibiotics, you have gone to the qualified doctor, but it is not relieved. Then the associated symptoms, hemoptysis, chest pain, loss of weight, loss of your taking food, anorexia, and at times dyspnea. You can walk, losing your weight. These are the associated. It may and may not.
If the doctors identify this somewhat early, is there a possibility of curing 100%?
Even if his diagnosis lately, it's a curable disease. But the difference in diagnosis early, the beauty of diagnosis early is that we are not suffering from the complications. Even if we are diagnosed late with complication, it's a curable disease. This is the message of the day. The tuberculosis is a curable disease. The treatment period is from 6 months to 8 months in different countries.
What is the difference between the HIV and the TB?
HIV is a disease caused by a virus, not a bacteria, which actually goes in and it decreases, it negligites your immune system, your defense power. Whereas the TB bacteria goes and harbor into the chest, and it slowly decreases your lungs initially and the centers. The HIV is a much more vigorous, but there is a combination in between this. Those people who are having HIV in their body and they are the patient of AIDS, they have got 90%, a very high grade chance to suffer from tuberculosis.
Actually, doctor, this sickness now is rapidly increasing in Pakistan, Indonesia and Malaysia, 3 countries.
No, there are 22 high burden countries. Although it is present all over the world, mostly in Africa, mostly in Asia, but there are 22 high burden countries. Amongst them, we do come, Pakistan comes, Malaysia comes, Bangladesh comes, India comes, Taiwan comes, Singapore, these are 22 high burden countries which are having the most burden of the disease.
According to your analysis, have you found any patients in Sri Lanka also?
Of course, Sri Lanka cannot be spared from tuberculosis. Sri Lanka is living near to Nepal, living near to India. This is a global world. People are interaction is a lot of there. So how it is possible that the tuberculosis cannot be present in Sri Lanka?
Do you have any interaction with the Sri Lankan doctors in relation to this sickness?
I never have had a direct relation, but I know in the SAR and in this they do come, they do meet, we do have meetings, we do go there. So there is on the level of the government, on the level of the NGOs, on the level of the WHO, Sri Lanka is involved in tuberculosis.
What are the final inclusions that you bring from this seminar of 2 days?
Sir, it's actually we have covered 2/3 of the patient of the world, but we are missing 1/3 of the patient. 30 million patients are being missed. It's still not being treated. It's still not being controlled. And you know, one TB patient in 1 year time, if not treated, makes 15 more patients. So these 30 million people, they're also the danger. They're the threat to the failure of the program. So what is the recommendation? That we all should unite together. We should unite, give hand to hand, and by what philanthropists, religious people, political people, these corporate people, experts, they should unite and they work and they find those 30 million people, bring in the circle and make our earth TB free.
So Doctor, thank you very much for spending your valuable time.
I'm also very much honored.
Wish you all the best.
I'm honored. And these simple words of mine goes to someone and creates betterment. This is a credit to me. Thank you very much.
Thank you very much, Doctor.